Welcome back. Now, empowering individuals to protect themselves, their families and their society is key in the response to COVID-19. These are some of the sentiments that are shared by Dr. Motsidisho Rebecca Moeti, the World Health Organization's Regional Director for Africa. So far, the UN Solidarity Fight has arrived in 38 countries across Africa with vital COVID-19 medical supplies donated by World Health Organization. Now, Dr. Richard Mihingo is a Deputy Incident Manager for WHO Africa Regional Office and now joins us via Skype. Good morning, Doctor, and welcome to GMN.
Good morning, and thank you to have me on your show.
Very well. Compared to the rest of the world, let's get into it. Compared to the rest of the world, how is Africa doing with the latest global pandemic, COVID-19?
Thank you very much. Africa was relatively safe compared to the rest of the world, but unfortunately we have seen the last 2 to 3 weeks an increasing number of countries that are now reporting cases, and probably we are entering in an active phase of transmission of the pandemic on the continent now.
Yeah, and indeed, I mean, the figures are showing that we have got over 20,000 COVID-19 cases positive and over 1,000 associated deaths to COVID-19. Which part of the continent are mostly affected?
Thank you. We have now almost all the countries on the continent that are currently affected by the pandemic. As of today, we have only 2 countries that have not yet reported a confirmed case. Those are Lesotho and Comoros. But the part that is mostly affected by the pandemic, it's mainly South Africa that is reporting the highest number of cases on the continent. But also we have countries in the northern part of Africa, Egypt, Algeria, Morocco, that also are reporting 1,000 of cases. We have seen now the outbreak going more in West Africa, with countries like Senegal, Ghana, Niger, Cote d'Ivoire, that also are reporting a lot of cases.
Okay. Now, we're seeing, I mean, with the extension of Lesotho and Comoros, all the other African countries are touched by this pandemic. Are the governments doing enough to prevent the spread of COVID-19?
Yeah, definitely. I think we have seen the government putting a lot of effort now to respond to this pandemic. Many countries have closed their borders because we have seen that importation of cases has been at the origin of this outbreak in many countries. Not only closing the borders, but also putting some of the hotspots, which are capital cities, on completely locked down. On top of those, we have seen government ramping up their capacity in not only testing the cases, but also putting in place rigorous measure in terms of social distancing, physical distancing, hygiene measures to protect population. But I think a lot yet has to be done.
Now, we have seen also the support with the World Health Organization that is supporting African countries to ensure that they have enough test kits to prevent or to detect early enough the virus by testing, providing testing kits to countries so that they promote early detection. Talk to us about the efforts of WHO as it relates to early detection.
Thank you very much. I think you have said it very well. WHO has been quite active since day one in supporting member states by providing the testing kits to the countries. As you have heard, WHO have launched the Solidarity delivery flights, which now has delivered not only testing kits, also other vital commodities like personal protective equipment, face mask, gloves, and since last week we are trying to see how also to increase the capacity of our countries in terms of ventilators, etc. But also beyond the provision of equipment, WHO has launched a huge program to support countries in terms of increasing their capacity. We have, before the lockdown become effective, we have deployed hundreds of technical people to support government in the fight of COVID-19.
Now, You have also issued guidelines to countries, and these guidelines are being updated as the new information and new science is uncovered relating to COVID-19. Let's talk about what do these guidelines include, some of the latest regulations that might be there.
Okay, some of these latest guidelines include, for instance, how to perform a good contact tracing. What is really critical in this pandemic is to make sure that the cases are identified early enough, tested, isolated, so that we can limit the transmission of the disease. I might stress here that we still have in Africa close to 18 countries that have reporting less than 100% of number of cases. So we have there a window of opportunity that those countries can seize to put in place vigorous measures to contain this disease at a very early stage. And these are the type of guidelines that we are putting forward. We have also launched improved guidelines for testing to make sure that countries have got the latest information on how to test population. Case management is another area that we are putting a lot of emphasis to make sure that the front line workers are well equipped with the latest guidelines so that they can take care of the patients more appropriately.
And we also know that from an epidemiology point of view, you're also doing a lot of surveillance work and you're putting in a lot of efforts to coordinate regional surveillance. Talk to us about these efforts.
Surveillance is key. Surveillance is key because the early detection of cases, testing them, isolated them, is the key to controlling these diseases. So what we are seeing in some countries where the social distancing measure not respected, I think this is very dangerous. I think our teams in the field, working with government in identification of case, tracking all the contact of the contact, I think it will be a key intervention to control this pandemic.
And you know that technology is a winning element during this fight of COVID-19. And you also understand that you have provided data tools to countries to help them to better track and understand the outbreak in countries. How are these countries taking this?
Yeah, the use of technology, and particularly new technology, has been quite instrumental in this fight. Many countries are currently launching a geographic information system, GIS tool, where through people working on their cell phones, we can track the contact, geolocalized those contacts that has been identified, so that the path to making a good control tracking can be well organized. We have seen the use of innovative other measures like the demographic health information system that is using electronic means, not only to identify those contacts. And I think it's helping a lot in speeding the identification of case.
Yeah. Now, Doctor, we also seen a lot of fake news and disinformation as it relates to COVID-19 in almost every country. And we understand that you're also helping countries to set up call centers as well as information centers for the distribution of accurate information. How effective is this initiative?
Yeah, you're right. And I would like to call upon the media, and if you can help disseminate the right information. At the beginning of this pandemic, we had what we call infodemic, where we have...
Jessica, that's for you.
Ignore the noise on the background, please. Just continue, Doctor. We apologize for the noise in the background. Doctor, please, over to you. Doctor, we apologize for those sounds in the background, yes. Let's talk about the setting up of information centers.
Yeah, as I was saying that at the beginning of this pandemic, we have seen what we call infodemic, where fake news, a lot of false information was circulating. Now that the social media is penetrating in most of our countries, we have set up strict guidelines to talk to countries where they've set up call centers. But it's quite important that the media help us in this information sharing so that you can disseminate the right information to the public from trust sources.
Great. Thank you so much, Doctor. Any final remarks from you?
I would like probably to stress the importance of the application of the barrier measure that has been put in place by WHO and other Ministry of Health to make sure that people adhere to the hygiene measure, to wash their hands whenever possible, to put in place that social and physical distancing. It's only that way that we can be able to control this pandemic. Thank you very much.
Thank you so much, Doctor. Great, there you have it. I was in conversation with Dr. Richard Mihingo. He's a Deputy Incident Manager working for World Health Organization Africa Regional Office. He was talking to us about the efforts that WHO is putting in and helping African countries to combat the pandemic that is COVID-19. And I will be back shortly to say goodbye.